All right, everyone, welcome to Player Development. I've got a guest here today. His name is DJ. He's a doctor of physical therapy, and we're going to be here talking about both physical therapy and mental health today. You're listening to Player Development, a channel focused on the intersection of sports and character growth. Please like and subscribe to support the stories being shared, the growth of our listeners, and to stay up to date with our latest content.
Thanks for having me, Isaiah. I really appreciate the invite and, happy to have a conversation about this stuff today.
Yeah, absolutely. We're excited to get into this. So, just as a way of intro, what level of athletes or what kind of athletes do you work with, and what does a normal day for you look like working with them?
Yeah, so I am a physical therapist and performance coach. So I actually own my own business. It's called The Athlete's Edge. It's a small little independent physical therapy practice that's located inside of a CrossFit and mixed martial arts gym. So with that being said, I do see a lot of CrossFit athletes. I see a lot of fighters and things like that. So in our academy, we have Brazilian Jiu Jitsu, Muay Thai, kickboxing, and regular boxing. So I see a lot of the fighters in house, the coaches in house. So, a lot of barbell athletes, CrossFit specific athletes,
Mm-hmm.
fighters are probably like the main clientele that I see here in the gym. And then since I'm located in, the town that I grew up in, I do see a lot of the local high school athletes here that I still have a relationship with. It's my alma mater, Cherry Hill West. So I do
Uh-huh.
have a good relationship with the sports teams there, which is great. Um, so I'd say my two biggest like niches, the biggest populations that I work with are generally barbell athletes, lots of
Mm-hmm.
soccer players. Those are my people, um, and fighters. And then, people that are just coming in looking to stay active and stay fit, people that consider themselves athletes for life. So really anybody that considers them an athlete, I love
Mm-hmm.
working with those types of people.
Yeah. So, walk us through what does a normal day look like for you with it looks like you're working with a wide range of different athletes who might be coming in with different problems.
Yeah, so it's interesting now that I'm out on my own in my own business. Practice looks a little bit different than it did when I was coming out of school, and probably maybe even what I would have imagined coming out of school. So right now, I do have clinic hours. As you can see, I'm in my office
Mm-hmm.
now during the interview. So I do see patients in the office here. Whether that is rehab services or if it is performance stuff, I do both with clients in person here. Uh, so I'm in the office back and forth throughout the day whenever I have clients here. We have classes here at the gym later in the evening, so I'm usually here around those times, helping with coaches, doing consults. If any
Mm-hmm.
emergency kind of thing happens, dealing with those things, putting out fires. But the majority of my day is working on the secondary portion of the business, which is, working with patients and athletes remotely. So I do
Mm.
see a lot of people that are strictly remote, and I do see a lot of people that are more on like a hybrid plan. So people that might come in for a visit every now and then, but have some kind of programming or, responsibility outside of the clinic, because I think that's the model that works the best at this point. I don't think people need to be in a clinic 2, 3 times a week anymore. Like that
Mm-hmm.
old idea of PT is kind of dying out. And I found to be super successful. The clients really like it. The accountability on the outside, having that interaction, like I feel like now I have more interaction with my clients than I ever did when I was
Mm.
just seeing them 2 to 3 times a week, because there's multiple checkpoints, and I think that accountability really helps guide their progress along the way.
Yeah, that's really cool. I didn't even realize that there was a hybrid or online form of physical therapy because I think, like you said, the old school model was very like hands on and you have to be in the office and have that hands on manipulation. So, um, yeah, what does that
I think that's
what does
one of
that look
those.
like?
I think that's one of those things that we're. I think that's one of those things that, there's a growing trend of PTs, especially
Uh huh.
post pandemic. Like everything else in the world changed, right?
Yeah.
PT is no different, right? Like I think there's always going to be a need for those traditional practices, those higher
Mm-hmm.
volume practices. But like anything else, people are looking for specialty type services, people that understand what they're doing. So, a lot of this came out of the pandemic, and there was a ton of PTs that were doing it even beforehand.
Uh huh.
So I think it's an up and coming trend that's going to take off here pretty soon as issues with insurance and stuff like that arise. That's a
Mm-hmm.
whole different topic. But
Yeah.
yeah, it's super interesting. There's a lot of people doing it, and I think the outcomes that people are getting with this model are, I almost think better than what it would be if you were just seeing somebody in person. So
All
I
right.
might be a little biased, but that's my take on it. That's my take on it.
Yeah, I mean, that makes a lot of sense. Now, you said that there are some people who might benefit more from kind of that more in-person model.
Mm-hmm.
Who do you think, or what kind of client or patient would stand to benefit the most from an online model?
From an online. So again, I think like anything else, there's always going to be a need for in-person PT. I do
Mm-hmm.
see a lot of patients that are still in person. Things like somebody coming out of surgery immediately post-op, like there's definitely immediate need that they kind of need some
Sure.
hands-on, more guidance. But even like my ACLs, like after the first couple of weeks that they're pretty self-reliant, if they
Mm-hmm.
feel confident with like their gym work and stuff like that, like we just set them up with a program that they can do on their own. And the good
Uh-huh.
thing about it, like there's a million ways of doing it. There's a million different apps now, training apps and things like that. But
Mm-hmm.
those clients are still sending me videos of their workouts. So it's not like
Yeah.
there's this air of like, oh, I don't know if I'm doing it right. Like literally I'll have my clients during a workout send me videos of them squatting or deadlifting or
Yeah.
whatever it is they're doing. And it's like that immediate turnaround like they are in person. And
Yeah.
I think that that check-in happens a lot more frequently than it would if you're coming in for, I don't know, 2 hours during a week. Like there's a lot more contact points,
Mm-hmm.
which is why I think those people tend to like that. But I definitely think it's more on. I consider myself, more of a PT that's more on the performance
Mm-hmm.
side of the continuum.
Okay.
So I definitely think it's more tailored towards that. But I mean, there's a bunch of people in the group, the community that I'm in for our business group, that are working with people with Parkinson's, that are working with people with
Mm.
MS, all kinds of crazy things that are mostly hybrid at this point. So it's
Wow.
just about how kind of creative you want to be with it. It's pretty amazing what some of the our group members are doing and what they're doing to kind of change the landscape of PT and healthcare in general. Um, so I don't know if there's an exact fit. Like, for me,
Mm-hmm.
athletes do well in this type of setup, but like a lot of people I know are making it work with whoever their niche is, like, which is pretty
Yeah.
incredible. It's
Yeah,
opening
it
up
really is.
doors for the PT community. Yeah.
Yeah. And it sounds like you're actually more accessible that way compared to keeping just the regular office hours.
I would agree. I would agree because if you look at how that time breakdown is, 2 hours a week, whatever that is percentage wise,
Mm-hmm.
versus multiple contact points, like a weekly real live check in. Like I think the outcomes are going to speak for themselves once
Mm-hmm.
this starts to take foot because it is still fairly new, even though I feel like it's so readily like known, but you just saying that you're
Yeah.
not, you're not familiar with it is more of a reason why we should be telling people that this is what we're doing because we
Absolutely.
do think it's pretty incredible. Yeah,
Yeah, knowing the options out there can definitely be, um, yeah, that can be building a lot of momentum for the practice and for that becoming more common knowledge. Absolutely.
absolutely.
And
Yep.
yeah, one thing I was noticing is that, looking at your social media, like you said, on the Athlete's Edge, features a lot of stuff talking about athlete mental health. So I guess I'm curious, as a physical therapist, I'm sure a lot of your training focused on the physical and the body aspects. So how did you come to really push for athlete mental health?
Yeah. So I think like anything else, right? Like no matter what field you're working in, healthcare especially, like
Mm-hmm.
it's the whole reason I went and became a PT and not, I tried to do, I was thinking about the whole med school thing, but, for me, like PT just fit what I wanted to do because I wanted to have more of a relationship with the clients that I was working with.
Mm-hmm.
I think about like what growing up going to like my primary care physician, and it's just like that one contact point a year that I kind
Yeah.
of get nervous for because I'm like, he's a doctor. Like I didn't want that, right? I wanted to be, even though I am a doctor of physical therapy, like I usually
Mm-hmm.
have my clients just refer to me on a first name basis because I want that connection because
Mm-hmm.
I think that connection goes a lot further in developing that relationship and um, you know connecting on a deeper level than just like a patient clinician interaction if that kind of makes
Mm-hmm.
sense. um, but it definitely, I'd say like my delve and my advocacy for mental health kind of goes back. So I guess when I was in middle school, at a really young age, I moved over here to where I'm at in New Jersey. I
Hmm.
think it was in seventh grade, and I was exposed to, our school was exposed to the idea of suicide and the topic of suicide at a really young age. So we had one of our teammates, unfortunately, when I was in seventh grade, take his own life. And I
Wow.
remember being so confused by that. I was the new
Yeah.
kid. Um, I didn't know what suicide was. I didn't know how that could possibly be a thing. Um,
Hmm.
and it actually turned out that this teammate was the one kid on our team that like welcomed me with open arms.
Wow.
He was somebody I had a really good connection with. So after that season ended and this happened, it was kind of like, why would he do that? Like what could have
Hmm.
been going on in his life? So I think that notion has stuck with me because of how he was nice to me, right? Like, and
Yeah.
if anybody's moved before, I don't know if you've moved, but like being the new kid and trying to find a group of people that you connect with,
Hmm.
like soccer was my thing.
Yeah.
Um, so that's how I found an in, and this teammate just happened to be the one that wasn't hard on me, that was encouraging, that helped me to have like a good performance in their first couple games, and helped
Hmm.
me kind of like break into my stride when I moved. So for that to happen was it was a marker in my life that I don't think I'll ever forget. And then even in high school, some of my best friends had family members that unfortunately took their own lives.
Hmm.
And it was just something that it was just confusing. Like why where we live, like why is this so rampant? Kids that you think have everything going for them, but
Hmm.
it just goes to show you that you never know what somebody's dealing with on the inside. By the surface looks of things, everything looks like it's going well, but you just never know. And then I guess more personally, in 2019, I actually lost my dad to
Hmm.
bipolar related suicide.
Yeah.
So that event was a major turning point. Um, it was a super dark time for myself and my family.
Hmm.
Just all the things that went into all the questions I had, the stigma I had around it. I was embarrassed. I would never tell people,
Oh.
how my dad passed, or felt uncomfortable bringing it up. It just kind of like felt like, I didn't know if people would judge me, and I don't know if that sounds kind of like weird that I was putting those things on myself, but
Hmm.
I just didn't want to talk about it. I wanted to put it on the back burner and kind of move forward. And it was tough moving on from that. So out of that, the pandemic came around the years following. Like it's just been a really rough time for people. And it gave me a lot of time to reflect on, how I could possibly use those experiences and channel it for good. So to draw awareness to a topic that I think is so important, that goes beyond, like these walks and wearing a
Hmm.
t-shirt, or all these things. Like I think it starts with talking about it. So I've gotten over that hurdle of being kind of closed off to talking about it, and I think that's been like the first step in me thinking that like maybe I can raise my voice. Like I don't know, if anybody's going to listen, but if I have some degree of a platform as a healthcare provider, as a coach,
Hmm.
as somebody that's working with kids, I'm going to try and use it, and try and use my dad's legacy and channel all the good memories I have of him, and put that towards something good that I can remember his legacy, and hopefully prevent something like that happening, or give somebody an outlet to talk about it. That's a
Yeah.
long-winded answer about it, but
Yeah. I mean, that's so powerful. Like you talk about from middle school on, that you've been shaped by people's struggles with mental health and are still being shaped by that and carrying their memories into your practice and work so that someone else might not need to suffer the same way.
right.
Yeah. And so, how does that look? on like a day-to-day basis when you are working with like maybe your high school athletes? um, how do you break down that stigma? How do you open up the channels of communication with them?
Yeah, so that's the hard thing, right? Like, is that
Right.
I graduated high school in 2009, so like
Hmm.
feels like a long time ago, and I don't ever remember having the stress. And I mean, obviously, you're stressed about certain things. You got deadlines, and you
Sure.
want to try and do your best at school, social life, all
Hmm.
those kinds of things. But man, like the kids that I work with now, they carry a stress that like I don't know if we ever had that.
Yeah,
And I
it
think a
feels
lot of it
different.
stems from it's so different, right? It stems a lot from I think coming out of that weird quarantine period where
Hmm.
like I think we saw what people being away from each other in these social environments kind of like does to people. uh,
Hmm.
it's tough. It's super tough. So the stress of school and these kids' social lives and social media, man, like I know there's a lot of good that comes out of social media, but I'll be the first to admit, like I freaking hate social media, right? And if I didn't use it as such a platform for my business, um, I'd take myself off of it.
Yeah.
It's a tool for me to try
Hmm.
and get messages out like this and to try and grow the business and to find people to help. Um, but there's a lot of crap on there, man, and I think
Sure.
it hurts kids a lot more than I think it helps them, because
Mm.
I think they have a harder time finding the good in social media, and they find a lot of the stuff that they're comparing themselves to.
Mm.
So honestly, on a day to, it's just honestly, man, I think it's just learning how to connect with people, right? I work with people. I don't, you know,
Hmm.
I think a lot of times the injury or the pain or performance is kind of secondary to what I do. The more I think about it now, I think when I was coming out of school, I wanted to be the PT with all these credentials and like wanted to
Hmm.
be able to manipulate people and dry needle and do all this cool stuff. And
Yeah.
now I'm just like, how do I better communicate? How do I better
Mm.
get people to understand what's going on? How do I make them feel more comfortable with that? And how do we address some things that often contribute to pain that they're like, wait, what? Like me not having a good day, me being stressed is making my pain worse. Like when you
Yeah.
tell somebody that for the first time, they're just like, there's no way. And then you start talking about some of these habits like sleep, nutrition,
Hmm.
hydration, getting out for a walk, and all of a
Hmm.
sudden their pain starts to like dissipate.
Yeah.
You just change that person's life, and they're bought in, right? Like they want more. They want that guidance and stuff like that. And not saying that I have magic powers. Just like I listen to people, I
Hmm.
communicate, and like most of the time, I know I'm talking a lot now, but I like to think of myself as a good listener and really
Yeah.
digging in on some of those pain points that I think a lot of people are
Hmm.
afraid to bring up and to dig into. Um, so that's how I try and
Yeah.
incorporate it on the day to day. Is just like I guess just connecting with people and being present with that person that I'm
Hmm.
with, whether it is in person or it's on a Zoom call or it's on a video check in or it's just through text. Like making sure that they know that I'm there for them, not just in the coaching role or the PT role, but like what do you need from me? Like how can I support you? That's my biggest thing.
Yeah. Yeah, that's big. And just talking about even those little habits, like you talked about, sleep, moving around, eating well, are not like, they're not so-called medical knowledge, but like you said, can be just as life-changing when you can get people to buy in
Yeah,
on
I
that.
think yeah, I think nobody wants to come to their PT and just be told like it's as easy as
Yeah.
sleeping 7 8 hours, right? Like are you
Hmm.
eating? Like when you it's crazy how many people aren't doing those like the basic things
Hmm.
consistently well. um,
Yeah.
it's kind of scary when you dig into it, especially like high school athletes are probably a big group of kids that I work with, so getting them to understand like how important that stuff is can be a major game changer, not only in their performance but like just their lives. It's
Mm-hmm.
insane that it's not common knowledge, like we talked about, like
Yeah.
with this hybrid thing, right? It should be common knowledge. So
Mm-hmm.
if this is a platform to get people to understand that, then let's do it, man.
Yeah, absolutely. And so, like you talked about, a lot of your work is with high schoolers. But just thinking about the athletes that you work with, you can pick whatever population. What do you think is one of the
Mm-hmm.
biggest challenge facing any of these groups of athletes?
All right, so this is good. This is probably going to be a multi-parter because I think it's a
Okay,
complex
go for it.
answer that I might get a little scrutiny for. But I feel like the biggest thing is, if we're just talking about athletes and at
Hmm.
large, it's what they're doing when they're not either playing their sport, like they're not doing enough.
Hmm.
That's not their sport, right?
Okay.
So I'll delve into that a little bit because I think it can get lost in
Hmm.
translation. Um, that doesn't mean like we just need to keep adding crap on their plate because it's going to have
Okay.
a negative effect, right? If you have kids that are playing their sport, or I even multiple sports, right? If they're doing something six,
Hmm.
7 days in a row, like that's the same thing over and over. A lot of
Hmm.
times, and this is where I'll put my PT and coaching hat on, is that
Yeah.
a lot of times the biggest thing that's missing with athletes is just some kind of like strength and conditioning program. And we're going to get to the second part of this. So I promise
Hmm.
we're going to keep on track. Um, but a lot of times, like if you just think about repetitively doing the same thing over and over and over again, you're
Hmm.
constantly stressing the same thing. You need some kind of change, right? Like your body needs that change up so that you're stressing different parts. So that's what I think strength and conditioning offers without going too far into the nitty gritty of that, right? Is just giving them
Sure.
something that they're not doing with their sport. And I
Hmm.
think the research is so abundant on the benefits of strength training and preventing some of these, like these big, like ACLs are an all time high. I've never seen as many ACLs now as I saw when I was in high school. I think I can
Wow.
remember in our age group, like the seniors and juniors and stuff around our age, like might have seen three, four. I see like
Hmm.
12, 15 a year.
That's
And
a
there's
lot.
teams that are, it's insane. There's teams of female soccer players that I have that I asked them to poll their team. 8 girls on a 20 person roster. Eight
Wow.
girls in the past like 2 to 3 years have had ACLs. Like it's insane. And a lot of times, it's as easy as getting people into the weight room, doing some things that will kind of counteract the stresses that they get in sport.
Hmm.
The other thing is, working on things that are more recovery dependent, like taking the time to do some kind of tissue work or mobility work, or just like go for a
Hmm.
walk, do something different than your sport. Because if you're playing soccer 5, 6, 7 days a week and you're not doing anything else, your body's going to accumulate some stress in those areas that probably
Hmm.
needs a wind down, right? And that's the other thing too, is that like taking a day to just maybe not do anything, right? Like an active, like
Hmm.
sorry, not an active recovery day. I know everybody talks about active recovery, right? And it's one of those buzzwords that I'm not quite keen on, but taking a day to just like be a kid, like go hang
Hmm.
out with your friends, because there's so many kids I talk to that are like, yeah, I asked them what they did over the weekend, and it's like, well, I had a tournament on Saturday that was three
Hmm.
games, and I had a game on Sunday. I'm like, well, what else did you do? My friends did this. Like, they're not being kids. Like,
Yeah.
they're being sculpted into these athletes that they're like robots, and they don't have time to be a kid. So I think that's a major problem because all they do is their sport. And
Hmm.
it's like they never have time to take a step outside of that athlete mentality, which is why I think they identify so strongly with their sport.
Hmm.
They need time to just find something else they like, because a lot of these kids have other hobbies that they just can't do because
Yeah.
they're playing sports all the time.
Mm.
And I think sports are a great outlet for athletes in terms of their mental health and things like that. But there's a point of diminishing returns, I think, on it,
Yeah.
which is where we got to kind of tread that fine line.
Hmm. Yeah, that makes a lot of sense. And you're talking about like having those days off or that time away from your sport can be good for both the body and the mind.
Yep, absolutely.
Yeah, so I think like you're talking about, there's a culture that's built up around youth sports, and I think obviously you're right in the middle of seeing all of that, where athletes maybe are specializing younger and younger, getting dedicated to one sport, and just never turning off from that sport. What do you think is a change that we can make as parents or coaches or as a culture in general that could better support youth athletes?
I, I think I think that it's such an easy answer that's never gonna like probably I don't want to say never. Never is a strong word,
Hmm.
but like ask the. I think the answer is asking the athletes what they want. Like
Mm,
that would be so easy. Like
yeah.
I see too many kids still that are playing sports because their parents are keeping them in that sport, which
Mm,
is like in this day and age, like it's insane to me. Um, that's why burnout and stuff is so high because
mm,
kids are sticking into sports and they've lost that passion for it, but they're playing because parents or something like that want that college scholarship. So,
sure.
like I think we're clinicians like myself, and there's a ton of chiropractors that I know work in a similar capacity that I do, occupational therapists. There's a ton
Hmm.
of awesome clinicians out there that are doing kind of like similar things to what my model, like what I think my model looks like. Um, but it's literally just having conversations with these athletes and seeing like,
Hmm.
is this something that you want or is this something that somebody else wants for you? You know,
Yeah.
and I think just listening to some of those responses when you get a kid that is always coming in, they're always fatigued, they're always tired, like they don't talk about their sport. Like I love soccer. I'm a soccer nerd. Don't get me started about talking about soccer because I'll go on for years. But like I have kids that are like in the sport and they just like when they talk about soccer or they
Hmm.
talk about basketball, whatever it is, it's just like, do you really still want to play this? Like, is this something that like they've taken the fun out of it, which is,
Yeah.
you know, where we start with that point. So a lot of times I think it's talking to the athletes and bridging that gap between these difficult conversations between the athlete and their parents and sometimes the doctors, the athletic trainers. Like I think if anything, it comes down to communication, like we kind of first started talking a bit.
Yeah. Hmm. And that's interesting that it kind of comes full circle, because like you said, sometimes you'll get that sense from the athletes that you work with that they're just tired of
Yeah,
the sport. And how do
yeah,
you manage that role as their clinician, and maybe seeing that they need to have a conversation with their parents? Do you ever step in to say like, "Hey, mom and dad, come in here. You need to, you need to hear this, or you need to talk about this."
yeah. So I think yes, we should be having those conversations.
Hmm.
You know, DJ coming out of school wouldn't have wanted to have those tough conversations.
Yeah,
Um,
that's hard.
but I think now it's at the point where like we're doing those athletes a disservice if we're not
Mm.
getting a collective like wellness team and getting everybody on the same page. I actually just had a conversation. I will be chatting with somebody's parent
Uh-huh.
tomorrow actually regarding like a post surgical case, and I think the when the expectations are set, not it's one thing to communicate something to an athlete and have them relay that to a parent or a coach, right? Like sometimes it gets
Sure.
lost in translation. The more contact points you have and the more cohesive like that team is,
Hmm.
like I said, talking to the doctor, getting an athletic trainer, getting the coaches, getting the parents, the more people that hear the same thing in the same
Hmm.
room, the more clear the expectation is. Like it takes away a lot of the confusion.
Mm.
Because I remember in the past, there's been times where I've said something to an athlete and they said something to their parent. I'm like, that is not what I said. It totally gets lost in translation, right?
Sure.
So why not just nip that in the bud at the source and just get
Yeah.
everybody on the same page in the clinic or on the phone or on a conference. Um,
Hmm.
I think the outcomes are way better that way. You set clear expectations. Everybody knows what they need to do, and then everybody figures out how they support that overarching goal, right? Like I think we got to stop stop separating that the athlete that's here versus the athlete that goes home. Like it's the same person. We just got to figure out how to
Hmm.
work out together to get to the goal that they're looking for, because ultimately, like that's what we're doing. Um,
Yeah,
so yeah,
makes
that's
a lot of sense.
yeah.
Yeah, so that's all the questions that I had for you, DJ. I appreciate your feedback on all of these. I'll leave you with the final word here.
Yeah, so yeah, I think the biggest thing is like one, I appreciate what you're doing, Isaiah. I think when we started chatting, like one, I was super humbled by you reaching out. Like I- will be honest, one of my goals for this year that I wrote down on a
Hmm.
piece of paper that I can check off today was to try and speak on some kind of podcast. So you've given me that platform, which
Yeah,
I
there we go.
greatly appreciate.
Hmm.
And I'm so humbled that asked to hear some of these experiences. Hopefully, it's
Hmm.
not too personal. I think sometimes getting to those personal stories helps just
Hmm.
iterate that point, and how important I think this stuff is. And I think one of the biggest things that I think you're doing, and there's a ton of other groups out there, is that just like having these open, real conversations about this stuff is ultimately what's
Hmm.
going to drive change. Um,
Yeah.
for too long, most people are just burying. It's the same people that people that are dealing with issues, with their mental health or struggling with things, like they don't feel like there's an outlet to talk to, which is why the suicide rates in college athletes and things like that are so high now. It's they don't feel like there's anywhere to turn. They don't feel like anybody's
Hmm.
willing to listen. But like yourself, a lot of the platforms that we mutually follow are giving people the comfort to speak up and to be listened to. And I think it's going to be a game changer in terms of getting these people the help that they really need. And I think conversations like this are the starting point, man. So if people out there are, trying to figure out what they can do, just lend a voice. Jump on a podcast, have an open discussion like we're doing now. And offer, whoever you're working with, whether you're a teacher that's working with students, whether you're working with athletes, you're a clinician, you're just a friend, like check in on your friends, check in on people,
Hmm.
be honest, be sincere, uh, really get to know what people are kind of like dealing with and offer them that safe space, because most people feel like there's not a safe space out there for them uh, to get those feelings off their chest and things like that. And I promise you, just listening to somebody and genuinely listening is going to have a major impact that I don't think most people understand that they can have. Um, so I think we'll leave it at that. I think that's a good. I think that's a good point.
All right, man. DJ, thank you so much for joining me today. It's been a pleasure speaking with you again. On Instagram, it's the Athletes Edge PT. Um,
Yep.
Everyone, go ahead and check out that page. Go ahead and like and subscribe for more content as we continue doing our Mental Health Awareness Month content. DJ, thank you so much for joining me today.